To access the White River Health System patient portal on our website, you will find in the upper right-hand corner this link to My WRHS Health. When we click on this link, it's going to take us to an area where you can enroll if you have not enrolled already. To enroll, you will need your email address stored within our personal medical record, and you'll also need your medical record number in order to enroll for the portal. If you've already done this, you can click on the link below, and this will take you directly to our portal where you can log in and access your information directly from any web browser that you would choose. So let's look at inside the portal at the different options that are available. This is the home screen that you will be presented with, and you can see here that it's a summary of activity that's happened within the last 14 days. Whenever you see this red icon, that indicates that there's new information available on your record for you to view. Below that, we have additional links that would be web links that you'll be able to click on. One will be in the future for paying your bills, and the other one is for the education site that we have on our website already. This is another way for you to access that information. If you have upcoming appointments that are scheduled within the hospital, you'll be able to see those, be able to see the date and the time. And you'll notice as I hover over these, this is turning green. Throughout the portal, wherever you see that green area, that indicates that you can click on that and you're going to be presented with more detailed information about that particular item. And then at the bottom, you'll also notice that it shows recent visits that you've had to our facility, which could be anything from an inpatient visit to an ER to having lab work or radiology work done that just provides a summary for you to view. To get into deeper information, you'll want to use the icons at the top of the screen. You'll notice there's 5 available for us today. The health record is by far the area that's going to have the most information about your personal health record available to you to view. As we enter this area, you'll notice that you have another summary of 3 different things: allergies, conditions, and medications that have all been documented on yourself within our medical record that are available for you to view. You'll again notice that all this is green, so if we click on any of this information, it'll take us into more information about that particular allergy, condition, or medication that you can review. So if we went and looked at allergy to penicillin, if we clicked on this, you would see the date that it was documented and any reaction or severity information that was documented in our record. So as we return back to this screen, in addition to the synopsis, you'll see the tabs along the right-hand side. The top one is called a health summary, and this is actually an area where you can generate a document that will provide a summary of any care that was done for yourself in an inpatient visit. So whether that's an operation or an ER visit or a medical admission, this will provide information that you could use for your own review, or you could actually take this information and send it you could download it to your own personal computer, or you could send this to a physician or another hospital if you so choose through a secure encrypted email system that's being dispersed at the national level for consumers' purposes. The health summary activity up here, this is basically an audit log of any of your information that's been viewed, who's done it and when, to help you have an understanding of who's accessed your summary of care record, to have a greater comfort level with the security of the system. As we return back, you can create these on demand. So an example of this would be if you had an inpatient visit and the day you were discharged, there's a potential for some information to not be in the system yet. And so if you came back in a day or two, you could actually generate a new summary record, and any lab work that may have been pending that would be available would be on that new record for you to view. And again, you can view it, you could download it, or you could email it to another provider if you wish. And then finally, you'd have the ability to print the summary if you so desired. So if we go back to the health record routine, the next area is allergies and conditions. And again, these are allergies or conditions that were documented by clinical staff within the hospital on your record, and you can drill into any of these and see further information. If you ever have questions about the data in here, first of all, we'd recommend that you contact your physician and validate whether it is accurate or needs to be changed. And you'll always have the option at the bottom of the screen to click on a Contact Us link, and an email will be sent to the hospital where we can help you either interpret or modify something that you may have found that may be an error. So going back to the health record again, the results area, this is where any lab work that you might have had done, whether as an outpatient or an inpatient, will be made available for you to view. And here you can see this is a summary of a large test, and you can see those results, and as we go across you can see the result and you can see the range. And as we look at this prothrombin time, you can see that it's listed as high, so this number is outside of this range. And every lab has a different range, and this is our hospital's lab range. So this is an example of something you'd want to talk to your personal physician about the results and understand the information and how it affects your care and what actions you may need to take. If there's a test within here that you want to monitor that may have been done frequently over time, you can click on each individual test and it will open up, and here you can see that you've had glucose level drawn multiple times within the past several months, and so you can start to see a trend of what those are if you have a chronic condition that you need to monitor. So going back to the list of tests again, you will see that same summary view of all the tests that you may have had done within the facility, and we can scroll down and see all of those within this screen. But we'll return to the health record page again, and now we can go into the medications area. These are medications that were documented that you were sent home on. This is not a list of medications that you were given within the hospital. Those medications would be on the summary care record that we looked at a few minutes ago. So these are any drugs that you were given to go home on. The great thing about this routine is as we click on these, there's actually an area in here where you can click and get more information about that medication. These are instructions on side effects, when to take it, when not to take it, and what to do if you have a reaction. So this is great information for you to have about medications that you've had prescribed. And then obviously at the top you can see the instructions of how frequently you're supposed to take that medication as well. So as we return back to the health record, again, in addition to lab results, any other reports done within the hospital, so these would be x-ray reports, physician dictations, all this information will be available for you to view just by clicking on these areas. You'll see the actual report. You can review that. Any interpretation, again, you'd want to refer to your physician for what the indications of that mean and what you would want to do with that. You're able to print this if you would like to have a hard copy of it. Otherwise, it will always be available in the portal for you to review. And then finally, in the health record tab, we have the visit history. And this is really a cumulative view of all visits you've had to any White River Health System entity. And you can see the dates and what the type of it was. Here you can see an emergency visit. And you can open that visit and get a little information about that particular visit as well. So that's an overview of the health record tab. We'll return back to home and continue looking at the medications area. This is really a repeat of what is in the health record tab. Exact same functionality. You can click in each one and you can get those same instructions that I showed you. Just a little easier way to get into that information if you'd like to do that. The next tab is appointments, and this is actually a way for you not only to see appointments that may be pending or scheduled, but you actually have the ability to request a new appointment within this routine. Obviously, you would still need a physician order, and the hospital will not be able to process any requests until they have that order in place. But here you could choose whether you wanted that done at Stone County or White River Medical Center, and then you can choose the appointment type within here. And then as we continue through, you can actually tell us what dates and times you would prefer to do it. You can see here that Saturday and Sunday are grayed out, indicating that that time is not available for that specific appointment. So you could choose Tuesday, Thursday in the morning, and any comments that you would like, and our staff at the hospital will do their best to accommodate your request and then return that information to you. In your contact information, you can give preferences of how you'd like us to contact you so that we can work with you and make this as accommodating as possible. Whenever a request is made for an appointment and it's confirmed, you'll actually see that appointment confirmation on this list, as well as the home screen summary when we first entered the portal as well. So as we return back, the next tab is the billing tab. And this is actually a future enhancement that we were going to put in that will show you any outstanding balances for any hospital visit. And in the future, you'll be able to see that, as well as to make any payments towards that bill as well, and we'll let you know when that is available. And then the final tab is the profile tab, and this is where you would put any information if your address changes, if your phone number or email address changes. This would be a way where you could update that information so that we'd have the most up-to-date information to keep you informed of any changes to your record in the future. One last feature within the portal allows you is up here as indicated on the change person. It's a routine called Proxy access. If you have children under the age of 18 or a spouse or parents who grant permission for you to see that person's record, you would be given access, and the list of those patients would be here. And as we click on a different patient, you'll notice that our patient name changes. The functionality of the portal stays exactly the same, but now we're looking at the information for that individual. So this would allow you to, if you're being a caregiver for your parents, be able to see their information, or any children to be able to keep track of that information as well. And you can do this simply by signing a proxy access form in our medical records department, and they'd be happy to set this up for you. So as we return back to our first screen, we'll be back at the bottom couple of options. You can always click the contact us and give us any feedback or questions that you have. Preferences, this is a place where you can update again your email address. This is a place you can change your password. There will always be a username and password to keep your information secure through this portal, and if you feel you need to change your password, you're able to do that at any point with this routine. And then the very last thing is the terms and conditions, which you'll be asked to sign the first time upon entering the portal, and then you can always refer to those here at the bottom as well. That's a quick summary of our patient portal for the health system. We hope that you find this to be a valuable tool in managing your personal health, and if we can answer any questions or be of assistance in the future, please do not hesitate to contact us. Thank you.